Hi guys, today's topic about esophagus or food pipe. It's about 25 centimeter in length. Length is about 25 centimeter. So this is the esophagus extend from lower border of cricoid cartilage, that is C6 level, up to the this level. This is T11 level or diaphragmatic level. So this length is about 25 centimeter. It's divided into three parts. This up to C6 and C7. This is called cervical trachea, and T10 or T11 is called, this part is called the, this part is called the abdominal esophagus. Abdominal esophagus, this is cervical esophagus, and rest, this longest segment is the thoracic esophagus. So this is cervical, this is abdominal, and this is thoracic esophagus. So longest is the thoracic part of the esophagus, shortest is the abdominal. So this is MCQ. Shortest part is the abdominal part of the esophagus. Now this esophagus having four anatomical constrictions. So four constrictions, that is important for the upper GI endoscopy or during foreign body removal and during contrast study of the esophagus. So what are the four constrictions? First constriction, from we are measuring from the upper incisor teeth. Incisor teeth. So this distance about at this level, this is 15 centimeter from the incisor, 15 centimeter. This constriction is Cricopharyngeal constriction. First constriction at the level of the pharynx or esophagus at the uppermost part, that is about 15 centimeter from the incisor. This is called first constriction of the esophagus. Second constriction is situated where arch of aorta is crossing, that is about 22 centimeter. Third constriction is situated where left bronchus is crossing, that is about 27 centimeter. And last constriction is situated at the level of gastroesophageal junction, that is about 40 centimeter from the incisor. So first is about 15 centimeter, that is upper esophageal or cricopharyngeal sphincter constrictions, and second is about 22 centimeter where arch of aorta is crossing the anteriorly crossing the esophagus. Third constriction is at the 27 centimeter where left bronchus crossing the esophagus, and last constriction is lower esophageal sphincter. So these constriction can be seen during upper GI or esophagoscopy. So this constriction is not seen while esophagus on rest or collapse. So on normal X-ray, it is not seen. If you give contrast because of peristalsis or during dilatation of esophagus, during upper GI endoscopy, you can see these constriction of the esophagus, but they are not seen when esophagus is collapsed. Now, if you see layer of this esophagus, if we cut this esophagus, then there are four layers of esophagus. Okay, four layer of esophagus. This first layer of esophagus is the mucosa. Mucosa or mucosa of the esophagus. Second layer is the submucosa. Third layer is the muscular layer or muscular external. And fourth layer is the advential layer. There are four layers. But in digestive system, there is another layer, that is serosal layer. Serosal layer. That is very smooth or sliding layer. That is absent in esophagus. So MCQ, serosal layer is absent in the esophagus. If mucosal layer. This mucosal layer having three component. First is epithelium. That epithelium is non-keratinized squamous epithelium. Second layer is the thin connective tissue, lamina propria. And third layer is muscularis mucosi. That is inner muscular layer. That is irregular longitudinal muscle or smooth muscle in the mucosa. So this mucosa having three parts. Epithelium, that is non-keratinized squamous epithelium. Squamous epithelium is up to the cervical esophagus. Thoracic esophagus having columnar epithelium or squamous epithelium mixture. And this abdominal having only, that is columnar epithelium. This lamina propria is the thin connective tissue, and this irregular longitudinal layer are the muscularis mucosa. Second layer is the submucosa. Submucosa. This submucosa having lymphatics, venous plexus, and nerve plexus. Nerve plexus is called Meissner's plexus. Meissner's plexus. So submucosal plexus of this esophagus is called Meissner's plexus, which control the peristalsis. So this nerve plexus which control the peristalsis, and this submucosa also having glands. That is tubuloacinar glands which secrete the secretions in the saliva. Enzymatic secretion of digestive juice into the saliva, that is called tubuloacinar glands. Third layer is the muscle layer. Third layer is the muscular layer, or you can say external muscular layer. This muscular layer having two parts: inner circular muscles or outer longitudinal muscles. In between this inner circular or outer longitudinal muscle layer is the Orbeck plexus. Orbeck plexus, or you can say Myenteric plexus. Myenteric plexus. Orbeck plexus or Myenteric plexus is situated here. This plexus control the muscular movements, and this Mishnah plexus control the peristalsis as well as secretion of the esophagus. And last layer is this last layer is the adventitia. This is thick connective tissue layer, advential layer. This is the thick connective tissue layer. As you know, digestive system having serosal layer. Serosal layer, that is gliding layer. But this esophagus absent this, don't have any serosal layer. So four layer: mucosa, submucosa, muscular layer, and advential layer. If you see this esophagus, blood supply, blood supply. Cervical esophagus supply by the inferior thyroid artery branches. Thoracic esophagus supply by the esophageal branches coming from descending aorta. These are about 4 to 5 branches. And this abdominal supply by the left gastric artery or left phrenic artery. Now, venous supply. Venous supply coming from inferior thyroid vein that drain into brachiocephalic vein. Thoracic supply in the esophageal branches that going into azygous vein, and abdominal part supply by left gastric vein or left phrenic vein. Lymphatic drainage. Cervical part going into the anteromediastinum, paratracheal nodes, and lower second, third, and fourth level of the lymph node, cervical nodes. This thoracic part draining into the posterior mediastinal node or tracheobronchial nodes, and abdominal part is going to the celiac nodes or gastric nodes. So this is all about the esophagus.